the rate at which the hospitalization numbers are going up is unprecedented in Alabama. Death numbers, fortunately, have not crept up significantly yet, but I think past experience has taught us that that is what happens next. Hospitals have reported that virtually all of their hospitalizations, certainly well over 95%, but probably closer to 99% of their hospitalizations are occurring in unvaccinated people.
For the first time since February, the state of Alabama is reporting that over 1,000 patients are currently hospitalized for COVID. Only 42% of that state's population is partially vaccinated. Merely 34% are fully vaccinated. In the past 2 weeks, cases have surged 217%, and health workers there are clearly frustrated.
It's really sad to see people so sick and to see their families suffer. I thought that we were on the other side of it and that people may still get sick and not require hospitalization after they got their vaccine. But I was hoping that we wouldn't have people this ill again.
For more, we welcome to the broadcast Dr. Jeannie Marazzo. She's an infectious disease expert and professor of medicine at the University of Alabama at Birmingham. She is also the school's director of the Division of Infectious Diseases. It's good to see you, Dr. Marazzo, but the numbers are disturbing. Alabama adding 2,667 new COVID cases. The last time, as we said, the state added more than 2,000 in a day was in February. What's your take with what's happening on the ground?
Well, thanks, first of all, for having us on to talk about this. To say that this is worrisome and really frustrating for us as healthcare providers and people who've been out there preaching to the choir for a long time is really an understatement. And there are several things that are really concerning. First, I think, is the pace of what is happening. You mentioned the increase of several 100% over the last several days. I can tell you that just early last week in the entire state, we had about 500 people hospitalized, and we are now over 1,000. And I suspect that by the end of this week, we will be close to 2,000. And what is so upsetting about that is that it doesn't have to be that way. Vaccination does prevent severe disease, and almost all of these hospitalizations are occurring in people who received no vaccination. So the key is to try to get people vaccinated against this really devastating surge, which is largely here being driven by the Delta variant.
So just to put a punctuation point on it, if everybody was vaccinated, you would have zero or near zero patients in your hospital suffering from COVID.
You know, you can never say near zero because some people are clearly, remember the vaccines are 94 to 95% effective. So you're always going to have a small percent of people who are not going to be totally protective. We also have people who have immune compromise, right? We have organ transplant patients. We have people who are on dialysis. They don't respond as well to the vaccine. But in general, all you have to do is look at other states like Vermont, for example, right, which have achieved astonishing levels of vaccine coverage, and they're not seeing anything remotely like this. And in fact, if you graph the rates of vaccination coverage with the hospitalization rate, you'll see that there's a completely inverse correlation. So I think there's no question. Also, when we look at the people in our hospital who are ill, we know that most of them are not vaccinated. Probably less than over 97% are not vaccinated. So I think the evidence is quite strong.
So you've been saying this, other doctors have been saying this, federal health officials have been saying this, some politicians have been saying this, and yet Alabama remains at the bottom, I think, in terms of vaccinations in the entire country. I can't imagine how frustrating that is. How do you turn it around?
Well, I think there are several things that have to happen. First of all, we have to recognize that at its best, science is the ultimately nonpartisan effort, right? I mean, even Governor Ivey in her op-ed in the Washington Post today made it very clear that the vaccine was an achievement of science. And it really is the sort of intervention where politics, political preference, opinions about certain personalities have no place. And unfortunately, the whole debate about COVID was politicized from the very beginning. It was really unfortunate and really has tainted our ability all along to discredit misinformation and to get true evidence-based scientific communication out there. What we need to do now is revisit the evidence base for the vaccine, try to reframe it for people to say, look, over 162 million people in this country have received the COVID vaccine. We are not seeing any common safety signals. The benefit so overwhelms any of the risks. And the benefit is not just to you personally, but it's to everybody around you, your family and your community. So I really think trying to reframe this as a completely bipartisan, non-political issue, we got to start caring for each other, take it more seriously. We really want to go back to normal, right? It's just everybody had this little taste of it the last several months, and it was just so tantalizing. And the only way we're going to be able to do it is to cut down the rate of viral replication in the community, shut down these mutants from continuing to form, and really protect people who are most vulnerable to the worst outcomes of this really devastating infection.